Hello. Today I'm going to talk to you about fainting or syncope and what are the reasons that you may experience a faint. Now, the most common reason of fainting is something that we call reflex fainting. Now, this is a neurologically mediated fainting which causes a drop in blood pressure and heart rate, and then you experience a faint. I think you would have either experienced one yourself or encountered someone who's experienced a reflex fainting or heard about it before. So this is caused by intense emotion, some extreme emotion, or it's caused by fright, such as seeing the sight of blood, or prolonged standing in the hot sun. These things can provoke a reflex fainting. The other causes of reflex fainting are if you wear a very tight collar, it may press on your carotid blood vessels here. You have two carotids here. So now if you have a very tight collar and you are sensitive, you may press an area here, that's the carotid sinus. Now that can trigger the nerves and the signals to be sent to the brain, causing a drop in blood pressure and heart rate, and you may faint. So this is called a carotid sinus syncope or fainting due to carotid sinus hypersensitivity. You may also experience a faint if you cough too aggressively, or in some elderly patients, when they are passing urine, this can also trigger the nerves to cause them to faint. So these are specific situational fainting, which is also reflex or neurologically mediated, what we call cough-induced fainting or micturition-induced fainting or passing urine-induced fainting. Now, there are also more serious causes of fainting, which can be determined by talking to the person who has had a faint, by interviewing the eyewitness who has seen the fainting, and by doing certain tests. So, fainting is either caused by some brain pathology or brain illness, or it can be caused by heart conditions. So, the brain conditions which can cause fainting, some are very obvious, such as if you've had a bleeding in the brain, or if you've had a brain tumor which is strategically located, and that may cause fainting. The other brain reasons of fainting are if you've had a seizure, that can cause fainting as well, but the person having a seizure may not be able to tell you that they've had a seizure because most of the time they won't remember. So this is where the eyewitness accounts becomes very important to me. The other things which can cause fainting is if you have had a stroke-like episode or a TIA, transient ischemic attack. Again, this can be determined when I talk to the person having a faint, and I determine from their history or from what they've told me whether it sounds like a stroke-like event or a TIA. Another not so common cause of fainting can be cataplexy. Now, this is a sleep disorder where you suddenly lose tone in the muscles of your body and you just fall to the ground. In some people, they suddenly lose tone and may suddenly fall asleep. This is called narcolepsy. In these very same people, some of them may fall to the ground and it looks like a faint. And this is called cataplexy. Now, what are the heart conditions which may cause a faint? So, you may faint if you have an irregular heartbeat. That means your heartbeat is too fast, or your heartbeat is too slow, or you may have both. You may have a heartbeat which is fast some of the times and slow some of the times, and this may cause fainting. In addition, if you have a structural abnormality of the heart, for example, if you have very well developed heart hypertrophic muscles, a condition called HOCM, hypertrophic obstructive cardiomyopathy, you may faint as well. Or if you have narrowing of one of the valves in the heart, specifically the aortic valve, a condition called aortic stenosis, you may also experience fainting, especially when you exercise or you exert yourself. The other cause of fainting can be what we call postural hypotension. Now, the blood pressure consists of a top reading called a systolic blood pressure and a bottom reading called a diastolic blood pressure. Now, if the top reading drops by more than 20 from lying to sitting or from sitting to standing, you may experience a faint. Now, what are the reasons that your blood pressure may drop? The blood pressure may drop if you have certain conditions or if you're on certain medications. If you're on blood pressure reducing medications, this may cause a drop in the systolic blood pressure as well. In addition, certain conditions like diabetes, which destroys the small nerves supplying these blood vessels, if these nerves are destroyed, the blood vessel loses the ability to regulate its tone. So you may experience a drop in blood pressure. And there are certain other neurological diseases which by itself may cause a drop in blood pressure. So these are the 4 main reasons that you may faint. You may faint because of reflex fainting. You may faint because of problems in your brain, such as having a seizure or a stroke-like event. You may faint because of cardiac conditions or heart conditions such as irregular heartbeat, or if you have a structural abnormality of the heart. And you may faint because you had problems with your blood pressure, or what we call postural hypotension, where your blood pressure drops when you change posture from lying to sitting or sitting to standing. I hope you've enjoyed this video. Thanks for watching, and I'll see you next time.